The Senior Resource is brought to you in part by the Senior Planning Center. Call for a no-cost Medicare review with one of their statewide team of agents. 778-6565. The Senior Planning Center. By Today's Options, offering Medicare Advantage plans to Maine seniors.
Well, hello folks. This is Tony Arruda again, representative from the Senior Planning Center, and we're here for another episode of the Senior Resource. As you know, these are programs that we've developed that are there to assist, help seniors or the general public on subjects that are so interesting to the individuals out there in the state of Maine. We're pretty excited today, I shouldn't say pretty, we're very excited today that I have a representative from the Department of Defense, the Maine Bureau for the Veterans. We love our veterans, and there's no question that this is so important because of the fact that they have many questions. In our office, and as well as from all of our agents out there, we get so many questions, and people are confused as far as what the veterans cover, especially on the medical side, and they all have togas, great reputation with togas, and what's happening. But there are a lot of questions. Who is covered? Who's not covered? Today, we have Mr. Jerry Smith. He is the Veteran Service Officer for that Maine Bureau of Defense for Veterans Affairs. Jerry, it's a pleasure.
Pleasure to meet you.
Now, when we start, why don't we just give a little overview on what you do, how you're tied in with the veterans, and what services you provide yourself.
Sure. As you said, I'm Jerry Smith. I'm Maine Veteran Services. My office is down in Lewiston, and I cover these areas, Androscoggin, Oxford, Franklin County, and actually Saginaw too. But we help veterans with claims, service-connected claims that have been injured or have illnesses from the service. We help widows of veterans. We help the widows of veterans file for either widow's pensions or what they call DIC, dependents indemnity compensation. We help the veterans themselves, the certain categories qualify what they call non-service connected disability pensions. And I think what we're going to be leading into is we also help with VA healthcare benefits. We also help the widows that qualify for what they call CHAMP-VA benefits, along with we pretty much can help veterans from the whole lifespan. Basically, we can help them get their new dependents, a newborn under their VA award, and we can help them fill out the cemetery applications to get them buried, so we can kind of cover them from beginning to start. So,
wow, you got quite a responsibility there as far as what's going on. Let's try to get it in a few different elements. One, in our operation, we get a lot of guys coming in and saying, geez, I wonder if I qualify for VA benefits. How would you suggest to the guy, what does he do? How does he find out? How does he go about determining it?
I'd recommend sitting down with somebody like me. We got 7 offices throughout the state, and they can sit down and talk to you and find out what you qualify for, what you're looking to do, because veterans benefits is a very broad topic, so we can help narrow it down and concentrate on what they need and help explain some of the jargon and stuff out there, and some of the misconceptions out there too, I think, about VA healthcare and some of the other programs the VA offers. Yeah,
we find that so often, and that's with our operation as well as all. We try to get a little bit of the confusion out. We get this in a lot of areas in Medicare and everything else that. It's unfortunate, and it's not anybody's fault, but they'll hear from somebody that might be involved with themselves, and they say, oh yeah, I have the VA, you don't have to do this, or you don't have to do this, and it'll cover this, and it'll cover that, but they may be talking about themselves based on a level that they may be in or not in. How is that basically broken out? Are there different levels of coverage, whether it's medical or services, that the VA has based on what your tenure was in the service, or?
Yeah, it's based on the individual, basically. I've worked with brothers before, you know what I mean? And just because both were in the service doesn't mean both of them get the same level of benefits and the same level and the same breadth of benefits too. So it depends on whether you served in a wartime or not, how long you served, whether you were activated out of the National Guard or Reserve. Some of it's based off of income. Some of it's based off your experiences in the service, whether you got injured, whether you were working on a flight line and had hearing loss due to jet engines and so forth. Whether you're a Vietnam veteran exposed to Agent Orange and you're coming down with some of the what they call presumptive conditions. Whether you're a recently returned Iraqi vet that's been exposed to burn pits and so forth like that, and you got respiratory problems. One of the big things that's kind of going out now is the Marine Corps veterans that were stationed at Camp Lejeune. There's what they call Camp Lejeune water contentions. And there's a whole list of what they call presumptive. And these conditions, when they say presumptive, that all you got to do is prove you were at Camp Lejeune during that time period. You come down with that particular illness, and the VA says, no ifs, ands, and buts, we caused it because of that water or contamination or whatever it happened to be when you were stationed at Camp Lejeune. And we kind of worked down through and found out what they're looking to do.
Yeah, so I guess what we're saying is one thing doesn't fit all vets. So it's important that they actually find out exactly how they apply or how does the system apply to them. We do so much in medical, and this is one area that I know there's a lot of confusion because we have a system called Medicare. That's the federal insurance program for seniors or people turning 65. Now, we have a lot of veterans, that approaching that age. Now, their question comes in, and we get it so frequently, is do I have to have Part B of Medicare? Now, Part B of Medicare there is a cost to it. Currently, all new recipients have to pay $134 a month. So they get Part A, and then they get Part B based on their employer. But then we'll get the controversy pertaining to say, do I need Part B or do I not need Part B to the Medicare program? And it's difficult to answer it because I guess there's a lot of different levels. Whereas if a person's at 100% or not 100%, so how would we deal with that specifically?
I kind of, as a veteran service officer, I kind of break it down and let them know and ask them questions. Are you sick? Do you have regular appointments you have to do? Is there regular medication you have to take? A lot of times I have them apply for VA healthcare if they qualified and see how it works for them. You know what I mean? Give it a trial run. It may work perfect for you. And I got people out there that swear up and down that's all they want is the VA, and Medicare they're perfectly fine. Others use a combination of, where if they got a respiratory infection or whatever, they can go down to the primary care physician, and it works best for them that way outside the VA system. Others find it kind of cumbersome to get into the VA just for a respiratory infection and get a prescription, let's say, for an upper respiratory infection, antibiotics. So it's basically based on the person, and what may fit you perfect today with the VA, you're perfectly healthy and you got nothing wrong with you, may be different, and you may regret your decision 2, 3, 4 years down the road.
Yeah, because see, what we as a company are trying to look into something pertaining to that, because when it comes to the Part B of Medicare, if a person doesn't sign up within the guidelines of the 3 months before, the month after 3 months, for their Part B, then and wanted to do it in the future, they're penalized unless they've had what we call credible insurance. Well, the problem comes in here is the way it's set up right now, the VA is not identified as critical insurance. So therefore, if a guy never signed up and now he's 70 and wants to get Part B, he's subject to a penalty to get to Part B. I personally think that's a little unfair because he has had credible coverage, but that's the system right now. So that decision as whether a person does Part B is important. It's not a cut dry answer to every one of them whether they should or not, but it does apply to a lot of people. But I know we get a lot of the veterans that they're very excited because of the prescription drug program.
Correct. Yeah.
However, because of our rural area, it's not always convenient for them to use the services at Togus because of the difference. We know there's been new government regulation that using outside the VA and all. How is that working? Are there any questions about it? Or?
I think you're referring to the Choices program.
Yes.
With the Choices program, I always tell veterans, if you've got a primary care position through the VA healthcare system, you're already enrolled, you're already in there, and they can refer you to a Choices provider on the outside, and that's what they got to be, as far as I know, signed up in the Choices program. Always make sure you get a written referral. Just don't assume that just because you're in the Choices program, you saw your VA provider, that you automatically can go down to Franklin Memorial Hospital, let's say, and get a battery test. Always make sure you get a written referral from your primary care physician, have them set up through the Choices program, which in turn, basically they contact you, the provider contacts you, says we're working through the Choices program, and then set you up with an appointment that way.
So that's an important thing for these veterans to know. It's just not that you can go anywhere just for the sake of going.
Just because you
have to get a prior approval. Well, in the whole medical field right now, everybody's getting prior approval to do different things. So
correct, and it's pretty much like you do on the outside where you got to get a referral from your regular outside doctor out in the community.
Yeah.
Just because you got the Choices card program doesn't mean you can head off and make your own appointments on the outside and have the VA cover the cost of care.
Now, let me ask you this question, because we have it in so many areas, because rural Maine is rural Maine. It's not always, with such a large state for facilities, whether they're hospitals, nursing homes, everything else, we have problems there. Other than Togus, do we have more than one facility that, let's say, a veteran could go to? Or are there different areas that for their medical needs?
Oh, for the medical needs, yes. They got several clinics out through there. Down in my area, Lewiston, right up on Challenger Drive, there's a fairly new facility. It's what they call them the Lewiston CBOC, which means Civilian-Based Outreach Clinic. It's a very nice facility. They have an optometrist there. They have primary care physicians there. They run a weight loss program out of there. They can draw blood and so forth to do blood work for veterans. So they run a wide gamut of different things. There's a clinic down in Saukville. There's one right up the road in Rumford. There's the Bangor Clinic. There's one up out of Bingham. That's a mobile clinic. And the farther we get out, the farther I get a little lost, because I cover my little area and I know it very good. But I've always heard good things about the Lewiston Clinic, the Portland Clinic too, I should say. I've always heard good things about that, and I actually use the Lewiston Clinic myself, so I can speak as a customer that I've always been well treated and always had good service there as a veteran.
So, just as a summary, as far as that, again, we go back to finding out the information, getting the proper information from the people that could do it. Now, one of the other areas people, I guess there is confusion on it. How does the government determine what kind of level you're in based on the amount of services, or how you would end up paying for certain services?
Okay. As of 2003, the VA made a decision, and they're going to base their health care on income levels, along with certain other factors that go on. As you mentioned too, if you have Purple Hearts, you can be accepted in the VA health care system. If you served in Vietnam, if you have what they call service-connected disability, so if you've been in the service and you've run the whole gamut from, hearing loss out on the flight line or working on a aircraft carrier, to broken arms, broken legs, coming down, being exposed to Agent Orange, coming down with prostate cancer, diabetes, lung cancer, ischemic heart disease. These are all conditions that being in Vietnam, being boots on the ground in Vietnam would get you into the VA healthcare system that way. They have a category, they range them down from 1 through 8, and it tells you the service or levels of care you would get. If you're if you're rated by the VA, and when I say rated, they said, okay, these illnesses or injuries that you have, they're caused by your time in the service. If you're 50% or more, that's free VA health care right there. It don't matter what your income is. If you're rated 0 to 40% for a service-connected disability, let's say hearing loss, they said, yeah, we caused you hearing loss. They will take care of hearing aids for you as far as that goes.
Well, we're going to take, that is great. We're going to come back, touch on that again, and a couple other areas that we get questioned are so important. So with that, we're going to take a quick break, and we'll see you real soon.
The Senior Resource is brought to you in part by the Senior Planning Center. Call for a no-cost Medicare review with one of their statewide team of agents. 778-6565. The Senior Planning Center. By Today's Options, offering Medicare Advantage plans to Maine seniors. The Senior Resource is a program for today's seniors. We'll be covering various topics that concern seniors and prepare them for what's next. Some of the very important topics will include Medicare, retirement planning, prescription drugs, Social Security benefits, and a whole lot more. Be sure to tune in each week for a new episode. Also, be sure to go to the Senior Planning Center website to view their collection of shows. That's theseniorplanningscenter.com, your home for great information regarding today's seniors.
Well, welcome back. This is Tony Arruda again with the Senior Resource. Today, we got Jerry Smith, okay? He's with the Veteran Service, he's a Veteran Service Officer.
Correct.
With the Maine Veteran
Services.
Maine Veteran Service. I'll get that out. Our last segment was very interesting, and we covered so many areas pertaining to the help that the veterans get and how to apply or what have you, and the different areas that they are able to apply into. Like anything else, we do this, we approach and talk about our ducks and getting your ducks in a row. And I think that's something a lot of the veterans should do, is get their ducks in a row, find out what services are available for them, and actually get to the right people so they get it correct. I mean, they deserve the veterans services that are out there, and I imagine there's a lot of veterans that there's services that they can have, they're just unaware of it, and they can get it. We're talking about the veterans, but in addition to that, we're always concerned about their families, the spouses, and everything else. And I think that's, in this segment, we'd like to try to get in more into what programs are available for the veteran spouses or families, and how do they go about it, how do they find out information.
Again, it's going to kind of boil down to contacting one of the local veteran service offices. There's 7 of us out there, and we provide the information, tell them to bring down what they need to bring down. If you're the spouse of a recently deceased veteran, or something has happened, we can help them as far as what they call a widow's pension or the death pension. So if it's based off of income, so if they're earning under a certain amount of money, or what they call DIC, Dependents Indemnity Compensation. And basically that's saying that the veteran was rated by the VA or not rated by the VA, but passed away due to a service-connected disability. I kind of alluded to the last section we did that if you were in Vietnam, or the Vietnam-era veterans are coming of the time, that let's say all of a sudden they come down and they've had a heart attack. They were exposed to Agent Orange, and ischemic heart disease is recognized by the VA as a cause of a presumptive condition that was caused by Agent Orange. That spouse comes in, and they may not even know that. The veteran may not even know that they could qualify for that. So we sit down. My assistant, BSA, Veteran Service Assistant, has them bring in a multitude of different things, unfortunately, but it's required. DD-214, marriage certificate, death certificate, and so forth. We sit down and fill out some paperwork, and they potentially could qualify for what they call DIC, Dependents Indemnity Compensation, based off the veteran's passing. And for them, it's right at the present time, it comes up to $1,257. It's tax-free. But all along with that $1,257, it also gets them to qualify for what they call Champ VAR. And Champ VAR is basically it's a healthcare program very dissimilar from the VA healthcare where you've got to go to a VA facility to get that taken care of. With them, Champ VAR allows them to go out on the outside and have a provider. And in a roundabout terms, they kind of work hand in hand with Medicaid to a certain extent, where you can use your Medicaid and they'd act as a secondary insurer for Champ VAR. And if you're awarded what they call your DIC, or Dependents Indemnity Compensation, that's one of the benefits they receive.
So actually, a veteran, I mean, that's why we like to get your ducks in order. Some of these veterans with their spouses or their children, whatever the case may be, it would behoove them to try to check into these things so people would know in the future what they would need or whatever the case may be.
Correct. Actually, another variant of the Champ VAR would be if the veteran was rated at 100% service connected and found unable to work, what they call permanently and total. The veteran themselves has VA health care. Also, too, being at the 100% level, anybody that's rated at 70% or more through the VA healthcare system also has access, when their time comes, if they have to go to a nursing home, if it's a VA-approved nursing home at the 70% level, the VA would pick up the cost of their care for nursing home coverage, which is not going to interfere with money coming into the household to keep the other household going. So that's something else that a lot of veterans don't know about, that if they're 70% or more, and it's a VA-approved nursing home like the Maine Veterans Home and so forth. In my area, I know it's Marshwood, nursing home is covered. Their cost of care is picked up by the VA. But their dependents are covered by Champ VAR if they're rated 100% permanently and total. And again, it falls in the same criteria, their spouses and their children. And their children can be covered by Champ VAR as long as they're attending school from 18 to 23 years of age, whether in either high school if you're still 18 and attending high school, or you graduate from high school and you're going off to college, they can still be qualified for Champ VAR. And it requires basically an application and an acceptance letter from the school saying they're attending school, so they can cover that way.
I know in our operation, I get a lot of people in, and we mentioned this kind of before, that people hear things on the street and everything else. And I know a lot of the guys say, well, I'm a veteran. If something happens to me, I'm going to be taken care of by the VA. Well, the misconception is there, not necessarily depending on your level or what have you. I mean, I've had a few people come in and they were under that assumption and found out it was a little different. Yes, the VA, they could go to a VA type of facility, but they would have to pay, and it's based on the income guidelines and everything, same as Medicare or Medicaid as far as that's concerned. You mentioned one thing about qualifying. Probably the most important document that a veteran has is his DD
214.
Yeah, and I hear that so often is, I don't have it, where do I get it? Or our family says, how do I get this information?
Yeah, basically, come down to the Maine Veteran Services. We got access to the state archives. We can help them if they were joined the service from the state of Maine or got out and they were resident of the state of Maine. A lot of times we have it, not every single time, because when they separate from the service, mistakes do happen, and it doesn't make it down to the state, or the copy was so bad we couldn't scan it. But they can come down through, we check, make sure that's them, we double check on ID, see if it's in there. If it is, they fill out a form, they can leave with copies of their DD 214.
Would you suggest families make sure they get a copy of that?
I tell them to lock it up in their safe deposit box. Case in point, I had a person come down and talk to me. We kind of alluded to, we help them as far as get cemetery certificates or burial certificates. The husband just had a burial certificate at the Maine cemeteries, Maine Veteran Cemeteries, had it stuck in a little cubby hole someplace. Spouse was cleaning up after the burial, the funerals happened, and come across that. Now she was feeling bad because did he want to get buried in Maine Veteran Cemetery or not? You know, down to, Damascotta where we had him buried, you know what I mean, or wherever it happened to be. So if I always tell people, if you get that, put it in the safe deposit box. We always have it, same with the DD-214 and all those particular papers, because that way, when you give it to the funeral home, they're going to know to contact the Maine Veteran Cemetery to have work with the cemetery staff up there to get your burial taken care of.
As far as the VA, I mean, this actually applied to me. I wasn't, just going back quite a few years now, I wasn't sure as to whether I would qualify for any VA benefits. I was in the reserves going back quite a few years, spent my active duty in the 2 weeks and all that. How does that relate to the VA benefits? Does it or does it not? Or
It's hard to say, Anthony, because a lot of times when you're a reservist back in the day, even my day, you could join the reserves and pretty much guaranteed you weren't going to be activated. Nowadays, National Guard, reserves, you're pretty much guaranteed you're going to be activated. Nowadays, after 1980, they had to have 2 years worth of service. They had to have 2 years or more worth of service to be in the VA healthcare and so forth. But during your reserve time, let's say you stepped off the truck, wherever you're doing basic training, broke your leg, that's service connected. But it comes out a sticky point. I find them sitting at my desk anyway, is you're a reservist, but the government didn't have you 24/7 like they do on the outside, like a regular active duty member. So some of the benefits aren't there, but I always say give a call, sit down and talk to somebody, because it's always no until you ask, you know what I mean? And we may discover something that, like you said, oh yeah, I broke my leg when I stepped off the cattle car at whatever training facility happened to be. That's a claim, where you never thought of it before, you know what I mean? So or you got activated for the Cuban Missile Crisis, or you got activated at some other time.
yeah, I mean, because I go back, a lot of the fellows that I was in through the Vietnam,
Yeah.
and even though I was in the Coast Guard, some of them did get activated to go over to Vietnam.
Yeah.
They worked on the rivers and all. Fortunately, I wasn't one of them at that time, but I look at it that way. This whole subject with the VA and the benefits that they offer, it just, I mean, and we see it in our operation. It's hand in hand with the Medicare and all of these kind of things. And as we find in the Medicare, it's confusing. There are so many rules. There's so many of them changed.
No.
And, this segment has been incredible. I really appreciate the fact that you were here working with this. We hope we can get the message out to everybody. I know it will be on the screen, how to get in touch with the people.
Correct.
But whether it be the veteran himself or a veteran, I think, who's thinking about how do I go about it, or the family, it's just so important, I think, that they get in touch with somebody. If they are able to get these benefits, they're there for that veteran. They deserve it. They should be getting it. Yeah. And we're there to support the veterans, and the help that you're doing is incredible in the department you're doing. It's just, well, if they have trouble getting in touch with you, call us at the Senior Planning Center. We'll refer them. If we can find out information, we'll do that for them also. This segment was great. We really appreciate the fact that you were here with us. And I'm sure you're going to answer any questions that go. You might get bombarded with calls coming in. With that, though, I'd like to just thank everybody out there for supporting us and listening to these segments that we have. We've had so many, and we're going to continue doing this. We're going to be doing it on retirement planning, and what is a trust, and what is power of attorney. All the questions in our operation that we get, that people ask us on a daily basis. And we're trying to get that information out to the seniors to help them. And that's why we call that the Senior Resource. So long.